Hi everyone. Here's your vaccine news you can use for the week. As of 8/25, 71% of Chicagoans 18 plus have received a first dose of vaccine. That's 57% of 12 to 17-year-olds and 74% of 65 plus. 55% of Chicagoans of all ages have completed their series. We've administered over 3 million doses of vaccine so far. But that leaves about 1/3 of the city that still needs to start their primary series. So a lot of work left to be done. With all this talk about additional doses and boosters over the last 2 weeks, we still want you to focus on initiating or completing primary series. Here you can see the vaccination rate in Chicago has stabilized over the past few weeks. We're hoping to see a bump in demand after full FDA approval of Pfizer, so please use that as a talking point with your patients. 60% of doses given last week were administered by pharmacies, followed by outpatient centers and FQHCs. These are particularly important locations for reminder recall efforts. First news of the week was that the FDA and ACIP recommended a third additional mRNA vaccine dose for moderately to severely immunocompromised individuals. So far in Chicago, according to iCare, a little over 3,000 third doses have been given, though we're unable to verify an immunocompromising condition for the recipients. 44% were given to 65 plus, 36% were Moderna, and 64% were Pfizer. Other news includes CDC announcing a planning assumption to start administering booster doses around September 20th, at an interval of 8 months after a patient's last dose. So far, no recommendations have been made for J&J vaccine, pending further FDA review of data. So, what does all of this news mean for you as a provider? For the time being, we need you to continue to focus on primary series. Keep working on building a culture of immunization in your practice, among medical assistants, front desk staff, nurses, and anyone else who works there. Train your healthcare provider staff to recognize common dynamics present in a vaccine conversation and share tips on how to recommend. See these CDC videos as examples. And we're also working here at CDPH on getting more training for your staff to become more effective in this space. Also, if your patients can't come into the office, don't forget you can refer them to our Protect Chicago at Home program to register for in-home vaccination. And that can be done by phone or online. Number 2, finishing incomplete series is a quick way to increase community protection. This means being persistent about reminder recall and using personalized outreach. Number 3, remind the families of immunocompromised patients that it is just as important for them to be vaccinated to protect the family member as it is to get the immunocompromised individual a third dose. Unfortunately, in the past month, we've seen deaths of immunocompromised children, likely due to COVID transmission from an unvaccinated parent. Let's not let that happen. As we await ACIP recommendations on booster doses, anticipate your system needs and manage patient expectations on timing with frequent messaging. Number 5 is my favorite topic. Make sure you're already co-administering COVID vaccine with other routine vaccines, especially during this back-to-school season. And be prepared to co-administer with seasonal flu vaccine as it comes into your office. As we've been saying for a while, there is no longer a 14-day spacing requirement. COVID-19 should be administered on the same day as routine vaccines. This includes inactivated vaccine, as well as live attenuated vaccines like FluMist, MMR, and varicella. Here are some resources for tips on administering multiple vaccines at one time. But it's nothing different than what we usually do. For more information on FDA approval of Pfizer, watch the next video. Thanks for listening and for making Chicago safer, one dose at a time.